Welcome, viewers. Today in our Dil Se Dil Tak Healthy Heart Talk Show special series on the occasion of World Hypertension Day, we have with us Dr. Yash Lokhandwala. Welcome, Dr. Yash Lokhandwala. Before we begin our talk, kindly give your brief introduction for our viewers.
I'm a cardiologist who has been practicing for about 3 decades, and I specialize in heart rhythm disturbances. I have been a teaching faculty at several institutes. Currently at the Sion Hospital, which is the municipal teaching hospital in Mumbai, and also much of my work is at the Holy Family Heart Institute in Mumbai.
Doctor, how common is incidences of high blood pressure in India and what are the common risk factors of hypertension?
The other important risk factors are, the intake, the type of food intake. We have changed from a natural food intake to preserved artificial foods which are high in sodium content. Even things which you may not understand, which you may never think, like bread and biscuits. Biscuits, okay, but bread even are high in sodium. And of course, the preserved food, type of food we've been having. Apart from that, it's stress. Stress is a very important factor. The other is alcohol. It's the single most reversible factor of hypertension. Smoking is another risk factor. Those who have diabetes are more likely to have hypertension, and we have a lot of diabetes in India. And then, of course, importantly, the family history. Someone with a family history of hypertension is much more likely to develop hypertension. So these are some of the important risk factors in India.
And doctor, on World Hypertension Day, what is your message for our viewers?
One is, hypertension is largely a silent disease till it gets advanced in many people. So, simple recording of blood pressure after the age of 20, because you must remember that most hypertension is primary hypertension or essential hypertension and usually starts between 20 and 40. So detect it early. Prevent hypertension. I was just discussing that our older generations probably live longer because despite the fact that there are no boiled water, no bottled water, they ate whatever came their way. But at that time, even the diet was much more natural diet, more homemade food. There were less pesticides and fertilizers in the food. There was much less pollution. Alcoholism was not rampant at all. And they had a relaxed life. That would be my message.